Now joined by a very special guest. This is Dr. Chadwick Hampton from Palm Beach Gardens Medical Center. Dr. Hampton, I want to thank you for your time. I know you're a busy doctor, and we are here to talk about the unfortunate situation of the Panthers captain, Aleksander Barkov, and the injury timeline with it. He could possibly miss the entire regular season with this. We talked about this kind of before this interview. We kind of looked at the video. ACL, MCL, underwent surgery. First of all, let's just talk about what those two things do for the knee and how crucial it is to an athlete like Aleksander Barkov.
Yeah, sure. Well, first of all, thank you for having me. I really appreciate you having me on today. ACL and the MCL. The ACL is a structure in the knee of one of the four main ligaments in the knee. Okay. ACL stands for anterior cruciate ligament, and cruciate means for a cross. So it's in the middle of the knee, and it stops the femur, which is the thigh bone, from and the tibia from translating anterior on itself, and that's its main function. It also functions in rotational moments as well. The MCL is another one of the four major ligaments in the knee. On the medial aspect, it stands for the medial collateral ligament, and the medial collateral ligament is associated for its stability on the lateral side and medial side of the knees. So there's four main ligaments of the knee, and apparently he injured two of the four.
All the fan base, everybody hopes the timeline is realistic to perhaps Barkov can come back for the playoffs, which would be April. That puts it at about 9 months. Is that realistic? Is an athlete more prone to recover sooner than others? And also keep in mind, whether he's in your care or what, these are players that have the top-notch medical care to do that as well. Is 7 to 9 months realistic? Is sooner even realistic?
Yes, however, not necessarily for the average Joe.
Right.
For a professional, first of all, they are a high-class athlete. They're not the average person in terms of their DNA and what's got them to be at this level playing a professional sport. So that's one thing. Second, it's their job. So they have their job 24 hours a day is to rehab this injury. Now, that all being said, the standard return time for ACL reconstruction is about 9 months to return to sport. You start agility drills at around 3 months in lateral motion, and you're continuing therapy throughout this time. But most of the time, you're not getting cleared to about 9 months. However, there's many instances that it takes over a year and up to more than a year to get back to the field or get back to the court.
Is there anything you can point to specifically that's helping shorten that recovery time over the past 5-10 years for professional athletes?
Yeah, there's a few things. We've just gotten better in terms of the science. Yeah. Our science is better in terms of our implantation and the actual techniques that we're using to do the reconstruction. They are evolving all the time. The actual placement, the timing of the rehab, adjuvants, adding a backup or extra stability, not just the graft or the tissue, but actual more suture to back it up to help protect the reconstruction while it's healing. We've actually added more things like PRP, which is platelet-rich plasma, which can help actually the incorporation of the graft, because the graft, you place the graft in the right position, but your body has to incorporate it. Okay. And it has to be what we call ligamentize it and turn it into your own ligament. And that takes a certain amount of time. So there's processes that we've developed and over time that has hastened that process. And then also the therapy has just gotten better.